The nervous system controls and coordinates all body activity, allowing us to speak, hear, taste, smell, see, think, act, learn, and remember. My name is Anna Golombieski, and I am the nursing educator in the emergency department of a Level 1 Trauma Center. The topic of this lesson is neurological disorders. The nervous system has two parts. The central nervous system includes the brain and spinal cord, which are protected by the skull and vertebral column. It is the central nervous system that receives and interprets signals from inside and outside the body and sends messages back to the appropriate body part or system. The other part is called the peripheral nervous system. It consists of many branches of sensory and motor nerves that extend to all parts of the body. The job of these nerves is to carry messages to and from the brain and spinal cord. Neurological disorders include some of the most disabling conditions and are often chronic and progressive. Conditions commonly seen by caregivers include stroke, multiple sclerosis, Parkinson's disease, dementia, and brain and spinal cord injury. These disorders affect multiple systems. Because they can have physical, behavioral, and emotional components, each person with a neurological disorder has individual needs. Deficits may include impaired mobility, communication problems, vision changes, and personality changes. Because many of these deficits are not obvious, neurological disorders are often misunderstood. This may cause others to feel uncomfortable, leaving the person affected feeling frustrated and lonely. The first condition we will talk about is stroke. Stroke has a cerebrovascular cause and is sometimes called a cerebrovascular accident, or CVA. There are two types of stroke, hemorrhagic and ischemic. Hemorrhagic strokes are caused by bleeding in the brain from a ruptured blood vessel or aneurysm. Ischemic strokes are more common than hemorrhagic strokes and are caused by a blocked blood vessel from a clot or from narrowing of the blood vessels. A transient ischemic attack, or TIA, is the temporary existence of stroke symptoms that resolve completely within minutes or hours. Even if symptoms do resolve, the person should get medical attention because a TIA may be a warning sign of a future stroke. Signs of a new stroke, or TIA, may include sudden numbness or weakness of a portion of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, or loss of balance or coordination, and sudden severe headache with no known cause. If any of these occur, emergency medical attention should be provided immediately. Treatment must be received as early as possible, and preferably within the first 3 hours, in order to prevent or minimize permanent damage or disability. Chronic symptoms of stroke vary depending on the area affected. It may include paralysis or weakness on one side of the body. A stroke on the left side of the brain causes deficits on the right side of the body, and a stroke on the right side of the brain causes deficits on the left side of the body. Other symptoms may include aphasia, which is the inability to express or understand speech, impaired vision, in which the person is unable to see half of the visual field, perception deficits, where the person may not be able to distinguish left and right, or up and down, or may not be able to tell where the affected part of the body is or what position it is in. Neglect, which means that the person ignores the affected part of the body or things on the affected side. Personality and emotional changes. For example, they may become slow and cautious or quick and impulsive. They may also laugh or cry for no apparent reason and be unable to control these emotions. The goal of nursing care of stroke patients is to maintain the skills and abilities that remain and to try to develop ways to compensate for new deficits. Assistive devices like canes or walkers or bathing, grooming, and eating tools may be helpful. If the stroke affects the dominant hand, the person may need to learn to use the non-dominant hand. When getting dressed, it is helpful to start with the affected side first. Do the opposite when getting undressed. Start with the unaffected side first. Prevent complications of immobility by proper positioning, especially for any paralyzed extremities. Passive range of motion exercises will help promote blood flow and prevent atrophy. Also, adequate nutrition and fluid intake, bathing, and positioning will help to maintain skin integrity. Due to paralysis or decreased coordination, many stroke patients are at risk for falls, so safety should always be maintained. Provide emotional support and promote as much independence as possible. Keep in mind that others may be unaware of unseen deficits like visual changes, difficulty finding words, numbness, pain, and depression. Another debilitating neurological condition is multiple sclerosis. It is a disease of the central nervous system in which the covering of the nerves in the brain and spinal cord becomes damaged and the conduction of nerve impulses is then interrupted. The cause is unknown, but the body's immune system is involved and causes lesions to form along nerve fibers. MS typically occurs in young adults between the ages of 20 and 40 and is 3 times more common in women. There is no single test that can be used to diagnose MS, so several tests and procedures are needed. Treatment involves 3 components. First, it may be directed at the immune system to alter the disease process. Second, specific symptoms are treated to improve function. And third, supportive care, like physical therapy and psychological support, may be necessary to manage deficits. Symptoms of MS vary depending on the area affected and can range from mild to severe. There are several categories of MS. Relapsing remitting means that the patient has attacks of symptoms that last several weeks and then get better. This type may develop into slowly progressive MS, which starts out mild and gradually gets worse over time. The benign type consists of episodes of mild symptoms that never develop into major symptoms or disability. The last category, rapidly progressive, occurs when a patient's symptoms get worse quickly and cause disability in a short time. Symptoms of MS may include weakness and paralysis, muscle spasms, pain, bowel or bladder dysfunction, swallowing problems, visual, emotional, or sensory changes, and cognitive changes like confusion and decreased intellectual functioning and memory. As with stroke, nursing care of MS patients includes interventions to prevent complications of immobility, especially skin breakdown. Preventing infection is also very important for MS patients. Because the immune system is involved, any type of infection may make symptoms worse. Be alert for signs of infection, including fever, fatigue, and worsening MS symptoms. Urinary incontinence and indwelling Foley catheters are common, so it is important to offer frequent fluids and provide good pericare. Adequate nutrition should be maintained by providing healthy snacks and assisting with meals if needed. Be alert for swallowing problems. Offer small amounts on the spoon or fork if the patient is being fed. Add thickener if appropriate, and assess the need for ground or pureed foods. Report any new difficulty with swallowing. Promote independence and provide emotional support by encouraging patients to plan their own activities, diet, and exercise, and to maintain or develop hobbies. MS is an incurable disease that affects most people during the productive years of life, so depression, isolation, and hopelessness are common.